What if I told you that the main reason healthcare in America is more expensive than anywhere else in the world and causes so many people to go bankrupt was not an accident? What if it was a series of deliberate, calculated decisions made over a single decade that proved to be a turning point? What if the system we all struggle with today was born in the post-war boom of the 1950s, a time we often remember with nostalgia for shiny new cars and pristine suburbs? We have an image of the 1950s as a golden age when everything was simple and worked. But beneath that shiny surface, a revolution was taking place in American medicine, a revolution that fundamentally changed the relationship between doctors, patients, and money. It was a decade when healthcare ceased to be viewed primarily as a service, like a priest performing last rites or a neighbor helping you fix your fence, and came to be seen as a commodity, a product that could be bought and sold on the open market. The engine of this revolution was the rapid and aggressive emergence of private, for-profit hospitals. This is the story of how American healthcare became American healthcare business. And to understand that, we have to go back to a time when the stethoscope was not yet a cash register. Before we dive into this topic, I'm really curious to know where you're watching this video from. Leave a comment right now and just tell me your city and state or country if you're outside the US. I read all your comments and I'm just curious to know where you're watching this video from. And as we go through this story, I want you to think about this. If you were living in the 1950s, and watching this system take shape, what would you consider it progress, or would you be concerned? Let me know in the comments. I'm very curious. To understand what was happening in the 1950s, we need to look at the situation before it began. Before World War II, the American healthcare system was fragmented. There were a few large, prestigious university hospitals, but there was also an extensive network of nonprofit public hospitals, often run by religious groups or charities, as well as municipal hospitals. The concept of a hospital as a commercial enterprise was virtually unthinkable and, frankly, a little distasteful. Medicine was a profession, not a trade. Doctors were pillars of society, but they weren't necessarily wealthy. They were often paid in chickens, pies, or promises. Hospital care was expensive for the time, but it wasn't a financial death sentence for the average family. Real change began with money, as is often the case. Two huge injections of cash, initially completely unrelated to healthcare, prepared. The first was the passage of the Hill-Burton Act in 1946. It was a huge piece of legislation, a federal program aimed at building hospitals. After the war, there was a sense that America needed to modernize its infrastructure, including healthcare, especially in rural areas where there was nothing. The government handed out grants and loans like candy, and communities across America used them to build new, modern hospitals. But here's the unexpected twist that no one fully appreciated. The Hill-Burton Act led to a huge oversupply of hospital beds. Suddenly, there were a lot of new facilities with empty wards. They had to be filled with patients to justify their existence. For the first time on a massive scale, competition entered the American healthcare system. The second infusion of cash was even more significant. It was the rise of employer-sponsored health insurance. During the war, the government imposed wage controls to combat inflation. Companies could not offer higher wages to attract scarce workers, so they began offering additional benefits, the most attractive of which was health insurance. The IRS cemented this by ruling that insurance premiums paid by the employer were not taxable for the business and not taxable for the employee. This changed the rules of the game. This created a flow of money from employers to insurance companies, which then paid hospitals and doctors. For the first time, patients did not pay most of their medical bills directly. A third party did. This severed the direct financial link between the service provider and the patient. When you don't see the real price, you don't ask how much something costs. You just consume. This is where our key figures come into play. They weren't villains with twirled mustaches. They were business people, entrepreneurs who saw an opportunity in this new, government-subsidized and insurance-funded environment. They looked at nonprofit hospitals with their charitable missions and sometimes inefficient operations and saw a potential gold mine. Thus, the commercial hospital chain model was born. The most famous or infamous of these early pioneers was a company called Hospital Corporation of America, or HCA, founded in the 1960s. but whose entire business model was a direct product of the ecosystem of the 1950s. But there were others before HCA. People like Dr. Thomas Frist Sr. and his son, who later became co-founders of HCA, were part of this new wave. They weren't just doctors. They were corporate organizers. Their innovation was to apply the principles of big business to hospital care. They centralized purchasing to get wholesale discounts on everything from beds to antibiotics. They implemented standardized accounting and management practices. They created branding and marketing campaigns, which was unheard of for hospitals at the time. They figured out how to maximize revenue from every patient, every procedure, every day of hospital stay. Efficiency was the buzzword. And at first glance, it sounded wonderful. Who doesn't want a more efficient hospital? But this new efficiency had a different master. The primary responsibility of a nonprofit hospital board is its mission. The primary responsibility of a for-profit corporation is its shareholders. This fundamental shift in allegiance is at the heart of the entire modern crisis in American healthcare. So the stage was set. Thanks to Hill Burton, there was a surplus of hospital beds. There was a flood of money from insurance companies working with employers, and there was a new breed of business people ready to build a corporate machine to capture that money. In the 1950s, for-profit hospitals began to grow rapidly. They grew by absorbing struggling nonprofit hospitals, often located in profitable urban areas, and by building shiny new facilities in affluent and wealthy suburbs. They targeted wealthier patients with good insurance. This is a very important point. They did not build hospitals in poor inner-city areas. They followed the money. This corporate model was also incredibly attractive to doctors. Commercial hospitals offered doctors modern facilities, the latest equipment, and, in many cases, a share of the profits. They created structures in which doctors could become investors in the very hospital where they worked. This created a powerful financial incentive to see more patients, order more tests, and perform more procedures. The conflict of interest was staggering, but it was often disguised as aligning interests. For the first time, a doctor's financial well-being was directly linked to the profitability of the corporation to which he or she referred patients. And how did people cope with this change? Well, if you had a good job at a large company that offered the new trendy health insurance, then you were probably fine. You saw the wonders of modern medicine: polio vaccines, new antibiotics, advanced surgical techniques. The quality of medical care for those who had access to it improved dramatically. The American middle class, excited by this new benefit, largely embraced the system. It seemed like progress, but if you were poor, elderly, or worked for a small company that didn't offer insurance, you were left with only declining public hospitals or the few remaining charitable organizations. During this decade, a two-tiered American healthcare system took shape. The gap between the haves and have-nots in healthcare began to turn into a chasm. The turning point, when the system really took on its current frightening form, was the realization by the commercial model of its most powerful tool for maximizing revenue: the bill itself. Because the patient was protected by insurance, the hospital could get away with inflating its list prices. They developed what is known as a charge master, a comprehensive list of prices for every item and service in the hospital, from Tylenol to open-heart surgery. These prices were not based on reality. They were fictitious figures, inflated to astronomical levels to maximize payments from insurance companies, which then negotiated a discount. But what if you didn't have insurance? You got a full, fictitious, bankrupting bill. This practice began in the 1950s and 1960s, when commercial organizations refined their business models. It was the ultimate perversion of the system. Healthcare became the only industry where you don't know the price of what you're buying until you use the service. And the price is often determined by a secret internal table designed to extract as much money as possible. The consequences of this revolution were profound and began to manifest themselves over the following decades. Healthcare costs, which had been relatively stable, began to rise steadily, and that rise has never stopped. The very nature of the doctor-patient relationship changed. The doctor was no longer just your trusted healer. He was also a source of income for a large corporation. Profitability considerations began to influence medical decisions, and the hospital itself was transformed from a community pillar, a place of healing and refuge, into a corporate outpost, a medical factory whose main measure of success was its bottom line. Of course, people foresaw these problems. There were unsuccessful attempts to correct the situation and steer America in a different direction. In the 1940s and again in the 1970s, there were serious attempts to introduce a national health insurance system similar to that adopted in Canada or the United Kingdom. President Harry Truman proposed a universal system, but these efforts were brutally thwarted by a powerful coalition, the American Medical Association, which cried, "Socialized medicine," and the nascent private hospitals and insurance companies, which spent vast sums on lobbying and public relations to portray any government involvement as un-American. They won. The profit motive was protected, and the system we know today was cemented. Now you may be thinking, that's a fascinating history lesson, but what does it have to do with me today? The answer, everything. The models that were established in the 1950s are exactly the same as those we see today, only on a much larger, more terrifying scale. The consolidation of hospitals into huge interstate corporations such as HCA and Tenet Healthcare is the ultimate of the corporate model of the 1950s. These organizations wield enormous power, allowing them to set prices and destroy competition. Let me hit you with some shocking modern data that traces its origins back to the 1950s revolution. A recent study found that in 2022, the U.S. spent nearly $4.3 trillion on healthcare. That's more than the entire GDP of most countries. We spend about 18% of our GDP on healthcare, while other developed countries such as the UK, Germany, and Canada spend between 9% and 12%. And with all that spending, our results are often worse. Our average life expectancy is lower, and our infant mortality rate is higher. How is this possible? Because most of that $4.3 trillion does not go to patient care, but to corporate profits, executive bonuses, administrative costs, with working with hundreds of different insurance companies, and marketing. It is a system that is inefficient for patients and payers, but extremely efficient in terms of generating revenue for the corporations. The recurring pattern is the financial exploitation of people's well-being. We see this now as private investment companies buy up not only hospitals, but also medical practices, nursing homes, and even ambulance services. They burden them with debt, cut staff to dangerous levels to increase short-term profits, and then sell them off, leaving behind a hollow shell of a healthcare facility. It's just the 1950s scenario on steroids. The flow of money from insurance and government programs such as Medicare and Medicaid is so enormous that the main business innovation in American healthcare is not finding new treatments, but finding new ways to extract a larger share of that flow. So here we live in a world where a single emergency medical event is the leading cause of personal bankruptcy in the richest country in the world. A world where people run GoFundMe campaigns to pay for chemotherapy. A world where you fear calling an ambulance because of the bill. This was not inevitable. It was the result of specific policy decisions, specific business innovations, and the specific triumph of corporate profit over the public good in one critical decade. This brings me to my final pressing question for you. We have seen how a system can be built and entrenched that serves the interests of the powerful at the expense of ordinary people. Given this history, do you think it is really possible to fix the American healthcare system from within, or does the entire structure, the very business model that originated in the 1950s, need to be torn down and replaced with something entirely new? Is reform possible? Or is revolution the only answer? I want you to really think about this. The answer to this question may determine the future of your health and your financial security. Share your thoughts in the comments below. I read every one of them. And if this deep dive into the origins of our flawed system has shocked you or taught you something new, please share this video with someone else. Share it with a friend, a family member, anyone who has ever wondered why their hospital bill was so high. And of course, if you haven't already, click subscribe and turn on notifications. We're just getting started, exploring the real stories behind the American economy. Thanks for watching.